Good afternoon. Today is Wednesday, the 24th of June, 2020. First of all, just to inform you that usually we have the CCSA general meeting on Fridays, but this Friday we will not have the CCSA meeting. It will be on Monday instead, next Monday of next week, because this Friday the Prime Minister will be attending the ASEAN summit via teleconference, in which Vietnam is the host. So first of all, I'd just like to inform you that before recapping what the spokesperson mentioned, first of all, that after this, there will be some representatives from the Ministry of Public Health, I believe the Deputy Minister, coming to speak about the immunity building and plasma and vaccine development after the English language portion. The Health Ministry will be giving their briefing. So, to begin first, just to recap a little bit more on what the Prime Minister, the guidance of the Prime Minister given last week, is that he expressed his full confidence that the crisis must help us reshape our nation and that we should emerge from this ordeal a new nation that is stronger, more respected, as one nation bound together tightly by common heritage, common sacrifice, and our love for each other. We must now lay the fundamentals of sustainable prosperity and open the way for Thais to rediscover who and what they really are, and all that they are, and that they are all truly capable of achieving. End of quote. So this is just to paraphrase some of the phrases that the Prime Minister had mentioned last week regarding COVID in terms of leadership and inspiration. So the spokesperson today gave us two clusters of very important information. The first is that in the past days there was this meeting chaired by the National Security Council regarding certain business establishments that remain closed, have not been opened yet. So the clusters of businesses that have not been opened yet up until today include the pubs, bars, karaoke bars, cocktail lounges, soapy massages, and the like, and also the internet and gaming shops. There are various detailed restrictions in which the National Security Council had outlined that still remain to be in place in these certain business establishments that have not been open yet. They are quite detailed, and the spokesperson showed some slides on this. I won't go into particular detail, but of course they are the rationale of why certain business groups have not been open yet. The details include such as various preventive measures, such as having closed circuit television, CCTV, including having shorter hours of operation for some of these businesses restricted, as well as the upcoming development of an application for the inspectors, including the Thai Chana application use as well. So all of these various measures are being put in place for the business clusters that have not been open yet. So that's why they have remained closed. Another piece of information that is important, that mentioned by the spokesperson, concerns the arrangements of foreign nationals in visiting Thailand. So since yesterday, there were small group meetings of the CCSA discussing about arrangements of having more increased number of foreign nationals visit Thailand in due course. And they've divided the group into three categories. Just note first that these groups are just indicative. They are, of course, separate from the arrangements and existing plans and the quota to bring Thai nationals repatriating back from abroad. That's separate, of course. And they are also separate from the existing scheme that is going on. As you know, of course, for foreign nationals with work permits and marriage certificates, and those with urgent cases, when we've announced that you can file that with the embassy for consideration on an urgent case with certain rationale or reasoning for that. So this is separate from that. The grouping that I will be mentioned is the general grouping in the plan in terms of looking forward, looking towards the future in receiving more foreign nationals in due course. So the group that is the first group that I'll mention are the business persons already in the wait list. So that would be those holding work permits. The arrangements for this group may begin pending CCSA approval of the wait list. I believe the requests have been filed, of course, according to the scheme in which work permit holders can file. So this will be cleared in terms of the wait list of this group. Also, pending approval, which may begin in the coming weeks, is the group comprising of government guests and official visitors, comprising of the short-term visits to Thailand of business persons and investors, skilled workers, experts, foreign teachers and students, and foreign nationals with Thai families. So these groups, of course, will have to be responsible for the expenses during quarantine, which is compulsory, which we call the alternative state quarantine. So in this group that I mentioned, of course, some of the persons in this group have already been filing the request to enter Thailand in the scheme that is going on. So this is inclusive of that. But this is a group, we increase the type of foreign nationals that will be requesting to enter Thailand. So, of course, as I mentioned, including government guests, skilled workers, foreign teachers, students, and the like, inclusive of the scheme already entering Thailand. Another group is the group that will be the visitors for medical and wellness purposes. And the group concerning the travel bubble arrangements, which is still being discussed. So the medical and wellness and the travel bubble groups are still under discussion for details because the evaluation has to be made and the discussion has to be made bilaterally with the various governments. So just to recap, the group of business people on the wait list, and then the second group is the biggest group, short-term visits, government guests, business people, investors, skilled workers, foreign teachers, students, foreigners with families. And then the last groups are the medical and wellness group and the travel bubble arrangement. So 3 or 4 subgroups in that. And of course, the spokesperson mentioned about the state quarantine. This is, of course, being done in parallel with the incoming group of Thai nationals repatriating. It depends, of course, on the capacity for the quarantine system. Thai persons going into the state quarantine system and foreign nationals into the alternative state quarantine system. The spokesperson also mentioned about the upcoming arrangement for the alternative local quarantine as well in the coming future, which I believe the cost would be not as high as the alternative state quarantine, alternative local quarantine. Okay, so one piece of information that was in the news since yesterday was a briefing by the Dean of the Faculty of Medicine of Sirirat Hospital. The gist of his briefing was broadcasted live yesterday through various channels. He talked about the need of Thailand and the Thai people to shift our paradigm, our ways of life in a holistic manner in order to maintain balance between health, economy, and social dimensions. He emphasized the importance of keeping our guard up since no new case of domestic infection has been found. But it does not mean that Thailand is already COVID-free. He cited a warning by the World Health Organization that we are still in a risky phase, dangerous phase, and at risk of a second wave since the virus was still spreading worldwide. And as you know, on the news, you can see some countries confirming that they have already been experiencing this second wave. Recent surges of infections in many countries, even those which seemed to have controlled the spread and already begun to relax with the preventive measures. So it remains for us to be vigilant and not relax in terms of our behavior in terms of health and hygiene. Dr. Prasit also urged the Thai public to use the Thai Chana platform, an application to track and keep the virus at bay. It would give you a message of warning if in the unlikely case of infection occurs in those places that you checked in and checked out. Moving to the general situation, the cases that we have, we did not have the English language summary yesterday on Tuesday, so I'll just recap that. Yesterday, we found 5 new infections, all of which were imported from Thai nationals repatriating from Egypt and Qatar. All were asymptomatic. 2 cases from Egypt, 1 male student and 1 female housewife testing positive on the 20th of June. And 3 other cases from Qatar are Thai nationals, 1 female, 1 female and 2 males. And they arrived on the 16th of June, testing positive on the 21st of June. That was for yesterday. For today, continuing with 0 domestic infection, but 1 new confirmed case reported, a Thai national repatriating back from a flight from the Philippines, making the total cumulative number of cases 3,157. 95% of that number have recovered or been discharged, and no fatalities. Very happy to say. An observation for today, the 1 new case for today is a Thai national, aged 31, worked in a restaurant in the Philippines, arriving on the 17th of June and placed directly into the state quarantine system, testing positive for COVID on the 22nd of June, and he was also asymptomatic. We have for you every day images of the activities of the Thai embassies as well. Yesterday morning, the Thai ambassador in the United Arab Emirates witnessed the transport of over 10 tons of medical supplies and devices provided by the government and the people of the UAE to Thailand in the fight against COVID. The cargo flight from Etihad Airways carrying the said medical aid arrived in Bangkok last night, so we thank the UAE for this act of kindness. Another image is the one from the Royal Thai Embassy in Paris, France, last week on the 18th of June with the support of PTT EP Public Company, sent over 500 cloth masks to Thai nationals in France by post. The embassy sent these through Thai temples, associations, communities around France to be distributed in various towns. Of course, these acts of kindness demonstrate the solidarity and cooperation between countries, among people, among the public, the private sector, in the fight against COVID. It reflects that COVID, of course, is transboundary in nature, and the acts and efforts to meet the challenges are also transboundary in public. The spokesperson also mentioned about the ASEAN summit that the Prime Minister would be attending through video conference this Friday, and that's why the general CCSA meeting would be on next Monday instead. So the regional response to the pandemic, for that, the 26th of June, this Friday, Prime Minister Prayut Chan-o-cha will be attending the 36th ASEAN Summit hosted by Vietnam. They're the chair this year. As you recall, Thailand was the chair last year. The theme, Cohesive and Responsive ASEAN. The meeting actually was supposed to be held in April, but was postponed to this month. It'll be the first virtual meeting of a formal ASEAN Summit in history ever. It's expected to discuss cooperation on the public health emergency and the post-COVID recovery plan, very much in line with the issues of sustainability and security, both in which Thailand was promoting during our chair of ASEAN last year as well. And the ASEAN leaders are also expected to endorse a joint fund set up by the ASEAN member states and their +3 dialogue partners, namely China, Japan, and the Republic of Korea. That was proposed in April of this year, aiming to procure medical supplies and support ASEAN member states in the fight against COVID. So just in conclusion, asking everyone, of course, to remain vigilant and continue practicing the good hygienic standards. You see in the news, the global news, many countries thought that they were over with COVID already, but that seems not to be the case. The second wave resurged in some countries. So please continue to protect yourself and your loved ones. If you recall, we talk often about the 5+1 measures. We'll have a slide coming up for you on that, the 5+1 measures, plus one being the use of the Thai Chana platform, in which Dr. Prasit Wattanapa, the Dean of Medicine of Sirirat Hospital, had reiterated in his briefing, and the spokesperson had reiterated quite often as well. So after this English language summary, I think we'll be having representatives from the Ministry of Public Health, the Deputy Minister of Public Health, coming to give some information regarding the project for immunity building, plasma and vaccine development, with various experts from the Ministry of Public Health as well. So thank you very much for your attention. Have a very pleasant afternoon. Please remain to stay safe and take care of each other. We'll fight the second wave together as always. Thank you very much. สวัสดีครับ
กราบขอบพระคุณ